Now that you have seen a scenario where the lack of teamwork and assertiveness, trust, and mutual respect became fatal to the patient's health, please divert your attention to a scenario where the patient survives.
Dr. Evan, I'm afraid there's a hole in your glove.
Oh, thank you so much for letting me know. Could you please help me remove this glove so I can put on my own?
As you can see, Dr. Evan displayed mutual respect and trust between him and Nurse Carla. Because he listened to her concerns, the risk of contamination in the sterile field has been eliminated, which will help prevent infection.
Dr. Evan, the patient's BP is dropping.
Oh, okay. Please monitor it. Please let me know if the BP drops below 90 over 60.
Teamwork and communication is displayed nicely in this situation. Nurse Carla notified Dr. Evan that the patient's BP has dropped. Instead of dismissing Nurse Carla, like in scene 1, he acknowledged the change and worked diligently while keeping the BP in mind. Since in this scene, Dr. Evan prevented infection by changing his gloves, the patient did not die from septic shock. But for the sake of this video, let's say that the patient did get an infection from an unknown cause. Observe the following post-op surgery clip. After the surgery has ended, the patient is taken to the recovery room. A few hours later, Nurse Jennifer observes that the patient has chills, a fever, and significantly decreased urine output. She then approaches the doctor to report the patient's status.
Dr. Evans, the patient has chills, a fever, and a significant decrease in urine output. What should we do?
Hang 2 large bore IV lines and administer an aggressive fluid resuscitation and broad spectrum antibiotic. Continue to monitor the urine output. If the patient condition does not improve, let me know immediately so that we can book an ER. We need to find the site of infection.
If Dr. Evan had taken Nurse Jennifer's concerns seriously, in scene 1, the patient would not have gone into septic shock, leading to his untimely death. Finally, imagine if Dr. Evan did dismiss Nurse Jennifer's concerns.
Dr. Evans, I'm concerned and uncomfortable with your lack of action. If you do not do something, I have to go to the supervisor.
All right, I'll take a look at the patient.
Nurse Jennifer used a cuss smile to express her concerns about the patient with Dr. Evan. She was assertive and not aggressive. Because of her unwavering loyalty to her patient, she was able to convince Dr. Evan to take her concerns seriously, thus preventing septic shock and death. Comparing this scene and the previous scene, you can clearly see that teamwork, mutual respect, communication, and assertiveness is crucial when providing care to a patient.